Well, we hate to talk about it, but it is important. The flu rears its ugly head between October and February every year. But while you think you probably know all the facts about it, you may not.
Here to dispel some myths and offer a little bit of practical prevention, we have Bellin Health Chief Medical Officer Dr. Cynthia Lasecki. Good morning to you.
Good morning.
Well, what are some of those most common myths that people believe about the flu? I was actually even asking you a few in the commercial break.
Well, there are quite a few myths, but there are three common myths that I hear routinely. Myth number one would be that the flu causes nausea, vomiting, diarrhea. Myth number two would be that the flu is not dangerous. Myth number three is that the influenza vaccine does not work. In fact, it could even give me the flu.
Oh, sure. Well, let's start with myth number one, because I hear this all the time, like, oh, I'm in bed, I was in the bathroom, I have the flu, or at least the stomach flu. But what is the actual flu?
Well, the stomach flu is actually gastroenteritis.
Sure.
But influenza is a respiratory contagious illness that has symptoms that somewhat mimic the common cold, things like fever, headache, body aches, dry cough, sore throat, runny nose, things along that line.
How do you distinguish when it's just a cold or when you might have influenza?
The common cold will typically start with maybe a couple of the symptoms and progress over the next few days before improving. The influenza tends to hit people all at once with a variety of symptoms, most importantly kind of fever and achiness.
All right, let's talk a little bit about some precautions, because as simple as it sounds, covering your cough and your sneeze is like a great place to start.
Absolutely. That's one of the most important things we can do is, as you said, cover your cough. So, grabbing a tissue, coughing or sneezing into the bend of your elbow, staying home when you don't feel well. Hand washing is an important way to prevent transmission of any illness, especially influenza. So, it's important to do that. They can estimate that you can reduce the spread of influenza by 20 to 30% just by hand washing, and in high-risk populations, even 60%. Most importantly, is to receive your influenza vaccine. That's the most effective way to help prevent the transmission.
And when it comes to the flu shot, the third myth you mentioned is, can you get the flu from the flu shot?
Quite a common myth, and probably one of the most common ones I hear. And the answer to that is no. Now, a couple of reasons why that's developed. One is that each year, the influenza virus is smart. It tries to mutate. And so scientists need to try to predict what is going to be the strain or strains for that year. So they, in anticipation of it, put together a vaccine that they think will be effective. And they do a really pretty good job with it, but sometimes it comes up a little bit short, and so it may not be as effective in a particular year. Even so, it's at least providing some, if not adequate, more than adequate protection. And the other common thing I hear about the vaccine not working is that it just doesn't work, and it could actually even give me the influenza. Well, it takes a couple of weeks for the human body to actually produce the antibodies responsible for fighting off that virus, and so if you contract influenza in the meantime, you might develop the illness.
Well, when is it time to see the doctor if we think we might have the flu?
So if you develop, a lot of times you can manage it on your own, use supportive measures, adequate fluids, rest, staying home from work, using over-the-counter agents to help with those symptoms. But if you start to develop some of those severe symptoms, things like high fever, worsening respiratory symptoms like increased respiratory rate or difficulty breathing, chest pain, pressure, severe aches, not getting adequate fluids, things along those lines.
You'll know it. And I speak from experience last year, You'll know when it hits you, and then you need to go see somebody.
Right.
All right, very good.
Well, there are flu shot clinics and all sorts of things happening across our area that can help arm you for this season. And the best place to start is BellinFluFacts.org.
And if you need to find a physician, make sure you have someone to go to. You're ready with that when that flu strikes. In case, 920-445-7373 to find a physician, or Bellin.org. Thanks, doctor.
Yes, thank you very much for having me.